Hi, everyone, and welcome to this event. Thank you for joining us today. As I was introduced, I'm Raquel Lorenzo. I work in Unlimited Spain and a Spanish accelerator that supports social entrepreneurs in Spain by providing them both acceleration and open innovation programs where startups work hand in hand with big corporations to help them grow their businesses. We truly believe in the power of companies to change the world, and that's why we somehow try to foster business partnerships to tackle the main challenges we face in our society, both social and environmental. And here today with me, I think this is a good example of what we do. We bring together in the table both startups and big corporations to discuss the big issues, and we are trying to shed a light on how is technology somehow enabling healthcare solutions and changing the healthcare system. But most of all, what is doing is somehow democratizing these services and making them more available to citizens, and in this case to patients. After all, technology is giving us more knowledge, more convenience, and thanks to it, we are just seeing and observing how patients are more empowered. And patient empowerment is a big buzzword nowadays in healthcare circles. It's also a trending topic in terms of innovation. Just for you to have an idea, nowadays 44% of our patients look for a healthcare provider online, and 1 in 4 patients at least use some sort of technology to either diagnose a disease or to monitor their symptoms. So technology is here to stay, and it's definitely changing the way we deal with the healthcare system. So starting with you, Paco, here from Lilly, Spain, we know that healthcare patient-centered models are bringing better quality results in terms of care for patients. They also have a big potential for cost efficiencies in the long term. And for that, we need, of course, to provide patients with more knowledge, more literacy, also give them solutions for self-management of their diseases, as well as make them share the decisions around their treatments. And I know that in Lilly, you guys engaged with your stakeholders to understand what are the main challenges in the ecosystem. And you also undertook several initiatives to somehow collaborate and cope with the system to address this. Among it is your work with patients. You're now releasing all content, sorts of content to help patients and caregivers to deal with their diseases, to understand how to take care of their treatments. You also made them part of your support programs by co-designing them with patients and make them an active voice in this process, which is, I think it's amazing. It's a good example how big corporations can have an active role in engaging with stakeholders. Tell us more about this initiative and how it is helping Lilly to accomplish its mission of making people's lives better through creating medicines.
Well, good morning, everybody. Yes, we had an initiative that year started like 1 year ago, where we decided to get back to all stakeholders in the health systems and start understanding better what they were asking from a big pharma company, you know, apart from the drugs that we provide to patients, what other needs can we fulfill better if we touch base with them, you know? And part of that initiative ended up in a few commitments we've made, especially with patients advocacy groups. That is the area where I'm more focused on. And the final goal here is to make, better instructed, more capable, and better patients more informed and with higher levels of understanding of what they need to do and understand their diseases. Since the very beginning, we've been doing patients support programs for many years, but we had more focus on teaching patients how to use our drugs, our treatments once they were prescribed, more than provide this information more broadly, you know, in general to the health community. So through this initiative, we reached the agreement that we were going to make these really available in our website. So right now in Lily's website, there is a patient's page where they can access all materials, educational materials that we have been editing, you know, and providing to other patients throughout these 20 years, more or less, you know, in diabetes, autoimmune diseases, cancer, all these areas now they can access. And it's not only information about drug that we are the legislation is very restrictive in this space, but we can educate them about health in general, you know, a lot of information about nutrition, how nutrition impacts their health condition, exercise, managing the levels of stress, you know, all these kind of things, you know. That is the first commitment. Secondly, in getting data, all the data that we publish, getting them more aware of what are these trials that we are planning to do, you know, and that was a very black space, you know, for many patients that they have a high interest for. So our commitment today is to, as you were saying, we need them to engage them from the very beginning. When we design all these programs, any kind of materials or any printed materials, digital materials that we create for them, we're bringing them on board. We used to do that, or we didn't do it enough, and our commitment is to open this space more to them.
Thank you, so interesting. And now going to you, Guillermo, from Udemy Day here, representing somehow social enterprises side. It's true that flexibility that comes with technology is very welcomed, but we cannot forget that with empowerment, there should be also equity of access for all patients. And eventually, if those approaches to empowerment are not well managed, we could amplify somehow the inequalities that we already see in the market. So services, I guess, should be designed in such a way that empower everyone, including those that are more vulnerable or disadvantaged. And that's why your work at the Udemy Day is so interesting, as you're now using 3D printed technologies to provide prostheses, arms for people all around the world for free, which is amazing, with no little mans in the between. And nowadays, anyone in the world could have access to such an essential service or product. And this is, for me, a good example of technology should serve good, apart from any other applications it could have in the system. Tell us more about how you, in such a young age, let's say, end up using this kind of technologies, and how you ended up creating a Udemy 3D, and how is it impacting these people? What are you hearing from them?
Okay, so thank you for having me here. I'm super happy to explain everything like that. Some years ago, I was a kid, and I was like an inventor of toy designer. And I started my university, and I started to work in a company of toys, designing toys. And it was thanks to the 3D printer, on studying about 3D printers and checking on YouTube, on Google, and blogs about everything, because we had no idea how to learn this in the universities in that time. So I decided to learn myself in that way. And I started to create toys, to create my own products. But I realized that I could help with that hobby, with that passion of the 3D printers. So I decided to go to Kenya. I bring with myself in my luggage 5 arms for people in there.
Wow.
And it works. It works. We create the first arm for people with no elbow, which is totally mechanic and made by 3D printers. And thanks to that, I say, okay, I cannot stop here in Kenya with these 5 people. I have to continue in worldwide. So I continue in Spain, I continue in different countries, and right now we are in 55 countries, developing for free these devices to 350 people per year. And creating, I mean, our main goal is helping. It's too easy not to do, and thanks to new technology, and the technology is the best way to help people. I mean, the democratization of new technology, and show people how to use the technology to help others and help the environment or the SDGs. So our main goal, our main idea right now is to find to find out how to reach all these 83 million people who need this kind of help and cannot afford any device for themselves, but also showing that technology must be a key, a tool to help people. So that's why we are developing new devices, and if there is just a person in the world who needs this, just a design, we are going to create it. We don't care about if it's profitable or not. We are going to create it, and then we will find the money. But we will do it because we did it in the past. We did it during these 5 years, and always, if we create something for one person, then it's a help for more people, 100 people. So that's why we do it, and we are continuing doing it right now.
And you should continue for sure for a long time. And now going to you, Tess, you're the founder of Bear Fertility, and definitely these patients are also consumers, right? And consumers, thanks to technology, are becoming more demanding, but also exerting more influence on the markets, which allows us not only to create new markets and open the doors to new entrants coming from all sorts of backgrounds, from telecommunications or retail. And this is great on a business perspective, but on the other side, it's also good that we are somehow expanding the reach of these health services for more people to have access to them. Eventually, of course, and this is what you're doing, decreasing the price of these services, making the financial burden for both sides, healthcare providers, but also to the patients, lower, which is amazing. So Bear Fertility is a good example on how a treatment that is so expensive, fertility treatment, can become more affordable for most people, and now women just can take the initiative to go for it and get it in their house. Tell us more about it. What are you hearing from your clients in terms of benefits? What do they value on your service? Is the do-it-yourself key for the success? What do you think they appreciate the most?
Yeah, so I'm Tess. I'm the CEO of Bear Fertility, and we're working on an artificial insemination device that people can use to start their families at home. So it used to be available in fertility clinics, and then in the 70s, it was replaced by IVF. So what we're doing is bringing it back, and we're bringing it back in such a way that it can be done very affordably in your own home. We ship you a treatment kit direct to your door. I think fertility is one of those sectors of medicine that is, because the treatment outcome isn't life or death, it's not cardiac surgery, it's a baby or no baby. You have an incredibly motivated group of people who are desperate to start their families, and the way the sector of medicine has evolved to date is highly privatized. So we see a lot of private equity-owned clinical groups, and if you are in the US, the average spend on fertility care is about $61,000. So for those of you who don't have $61,000, what are you doing? And that's where we come in, with treatments that are closer to $1,000, $2,000. And the beauty of what we're trying to do is bring effective care back into the home. So fertility is not very regulated. In sort of less regulated environments, you tend to find a lot of companies coming in and creating things that maybe aren't effective, aren't safe, haven't been proven. And we're trying to move away from that and set the bar in a place that brings the whole category up. So the efficacy rates on what we're trying to do, over 6 treatment cycles of our treatment, you're looking at an efficacy rate of about 50%. And in the US, it'll probably be priced at around $3,000 for those 6 cycles of treatment. If you're in the US and you go for 6 cycles of the closest clinical equivalent, which is IUI, intrauterine insemination, you're probably looking at about $24,000 to $30,000. You're in the clinic about 30 times over that 6-month period. And you're looking at an efficacy rate of about 63%. So what we're saying is for the extra 10% uplift in efficacy, it doesn't correlate to the cost, the burden, the invasiveness of that treatment. So for us, it's time to create a technology, a treatment that helps everyone create their family, not only the people who can afford to go into a clinic.
Amazing. That's amazing. We still have time for one last question. It's gonna be a last question for all of you. Just gonna read it, and you just decide who answers first, okay? But definitely, I think the underlying message here is that patients are now taking greater accountability for their healthcare and the management of their diseases. And obviously, as we can see, this is creating new markets at a global level and also new ways of caring, new models of care for sure. Paco, as a global company that Lilly is, a pharmaceutical company, related to these, I would like to understand what you think are the main innovation challenges you're facing nowadays and how you're addressing it. And for you, for my entrepreneurs here in the States today, as these patients now who are more empowered, of course, are also a very good source of information in what regards to how they deal with their disease on a daily basis and how these solutions and treatments and services are helping them to cope with it, like the impact of it on their daily lives. Are you active on hearing from your clients and patients to understand how are your solutions helping them? Is measuring the impact of what you do important for you in how you manage your businesses?
So do you want me to start? Well, the biggest challenges that we are facing today is how do we make healthcare professionals more aware of the need of the patient? Because they have a different perspective over the needs, more based on biomarkers and all these kind of things than really what happens at patients' homes, you know? And so if you ask any healthcare professional, I would say, is adherence a problem? They will say yes in general, but if you ask, do you have a problem with your patients and adherence? They would say, okay, with very few of them, okay, which is not true, but it's not measured. So convincing them of that they need to have an intervention in this area. They cannot afford to be the only point of contact for the patients forever. They don't have the capacity to do that, you know. And for us, it's showing them the value of these interventions is one of the biggest challenges we have. That I guess is the same, at least with the context that we have with other newcomers into the digital space, into the health space. We are facing exactly the same challenges, is how do you show the value? This requires a lot of effort and budget, you know, to create these kind of clinical trials or real-world evidence data and analysis, you know, that internally, although we are a big company, this is a massive investment, you know. And normally we dedicate these resources to demonstrate how our brands or our products work, you know, but not how our services work. So I think this is the future. This is where we are concentrating our efforts more and more, you know, to be able that, and there is tons of a wealth of data out there, you know, about how gains in digital connections with patients and education with patients raise the level of their awareness, you know, and their adherence, you know. But it seems that it doesn't stick to people's mind. So we need to change the healthcare professional mindset quite a bit, you know, and this is what we are working with them right now. I don't know if you agree or not, but...
Yeah.
Yeah.
Tess,
Go ahead.
you want to start?
Go ahead.
I think similarly, one of the challenges we face is access to capital. So you talk about investment. On the startup side, we're over here trying to raise money to develop a direct-to-consumer medical device. And at the moment, the investment world, you've got the medical funds who turn around and say, you know, why are you speaking directly to patients? Why would you do that? And then you have the consumer funds who are like, why haven't you commercialized yet? And obviously, when you're building regulated hardware, we need to go through clinical trial. It's not that simple. So access to capital to create these technologies that do allow us to start democratizing access to healthcare is, I think, one of the most pressing challenges in the sector for startups today. Educating healthcare professionals and physicians. A lot of healthcare professionals sort of see these startups coming into the space and they feel a little bit threatened by these technologies. And so I think for me, the answer to that is actually getting closer to clinicians and being more in the medical community and sort of playing a bigger role in educating and stay friends with the medical sector that you're going into to disrupt is what I'd recommend there. But I think in terms of measuring impact, for us, it's all about making babies, really. So if we can count the number of babies that happen as a result of the technology that we've launched, we know we've done our job.
Great, nice. Well, I'm gonna ask and answer in little by little because you ask about funding and the wonders in funding in this case. You can imagine is we develop for free devices, you know. So in our case, we create like a social business model showing different entities, schools, companies, organizations, how to use the technology for help. So thanks to that, we create some school programs to showing kids that technology must be a way to help people. They are creating hands for people who need this. We are creating team buildings with companies. We are like focused and sensitive with the social value of technology. And also, of course, we have sponsors and projects that help us to continue with these projects, and also creating 3D hubs in different countries to empower territories, creating the devices totally there. For example, we have a 3D lab in Kenya. We teach them how to use the technology, how to create, design, and print arms for local people, and they are totally independent right now to improve themselves. So if you talk about impact, so for example, in the beginning it was super difficult because I went with my luggage with 5 arms in there. I say, okay, this is for you, bye-bye. But no, after that we started to continue this communication with all the patients, with all the people who help. We helped, and we started to have feedbacks. We learn a lot about that feedback, about they are shy to show our robotic hands, so we started to create nails, we create knuckles, we create something with the skin color of the person. So we started to develop this also psychological, I don't know what's the name, but psychological part of this to improve our designs. But also we started to learn about how many people we help, not just the people who need this kind of device, but also their families, because this person was totally dependent of the family. Their mother or the father or the cousin or whatever have to take care of him or her during the day. Now they can get a job, a full job, and also the guy or the girl, the person who has the device. So we also study this KPI impact, not just taking a hand, giving a hand, but also if they have better opportunities of jobs, if they can go to schools, if they have more independence, they are more, efficient in their lives. Also, we are kept KPIs with the plastic we use, the recycled plastic we use, also measuring the children that we help to know how to use the technology to help. The people, we teach them how to use the technology if they get a better jobs. So we are studying to create more efficient ways to know how we do it and how can we improve. So that's it. And I forgot one thing because I had my fingers here like 1, 2, 3, and the third I forgot, but it's not a problem. But also, actually, it's good because this third part I can show you in our stand that we have outside, close to the food trucks. So we are there, and if you have any more questions, we will be happy to reply in there today or tomorrow.
Thank you, Guille. I think if I have to wrap up the message here today is that definitely technology is changing the way we deal with the healthcare system, with our disease. We all eventually going to be users of the healthcare system at some point, and it's amazing how technology is bringing a lot of possibilities to it, but we cannot forget how people, the patient, has to be in the center of everything. And entrepreneurs are the key, in my opinion, to make it faster for these technologies to actually become solutions that could be of use for all of us. Big companies had to lead the way, and they have the ability to mobilize all stakeholders and make us work all together. It has to be a collaboration process as to make innovation go faster. And definitely, if you enjoyed today's conversation, I would invite you not only to reach our panel today, but also reach us out in Unlimited. We join you into this conversation with big corporations and startups to discuss the future of the healthcare system. Thank you so much for joining us, and I hope you enjoyed.